We continue to watch a surge of coronavirus cases here in Colorado, but it's not just our state that's struggling. Nationwide, the numbers are going up. So joining me now is CBS 4 medical editor Dr. Dave Hnida. And Dr. Dave, are you concerned we'll see another surge with the holidays coming up, and are we equipped to handle that?
Yeah, I think we're all concerned that we've got some big problems in the future here. I think that when you first look at Colorado right now, we are certainly seeing a spiral of bad numbers. We're seeing increased cases. We are seeing an increased test positivity rate. We are seeing increased hospitalizations. And certainly we're very concerned that as we get into the holiday season, these things are just going to get worse and worse. Colorado, in fact, has projected that when we hit an area or time frame around November 10th, we will surpass our record hospitalizations that we hit in the spring. And just by hitting that number doesn't mean that it's going to automatically stop there. It will most likely continue to rise above what we will see at that point in time, and we will unfortunately surpass the terrible numbers and suffering that we saw back in the spring. If you take a look at what's going on nationally, there has been some modeling done by the University of Washington, which is a very reliable source of information in terms of just projecting where things are going in terms of hospitalizations, and in particular, what's going to happen with intensive care unit beds. ICU beds are vitally important, as you would realize, because of the fact that that's where the most critically ill patients wind up going. And as you look at the projections, they show that more than 20 states in the month of November will exceed their capacity for ICU beds. They will be in need of additional beds that just simply do not exist. Colorado is projected to exceed its ICU capacities by late December. There's a possibility it could always go a little bit later than that or a little bit sooner than that, depending on spread. But the bottom line is that the unfortunate thing about these projections is that they were done recently, and we have already seen that we have passed the ICU capacities of many states that were thought to be in some sort of a safe zone. So we've got some worrisome times ahead. We certainly have not turned a corner when it comes to COVID in the country or in Colorado.
Yeah, we know testing is such a big component of this, and Costco recently announced it would start selling at-home coronavirus testing kits. What's your take on these take-home kits?
Yeah, interesting, because Costco is coming out with a deal where you can get an at-home test done through their store. Now, there are some goods to it, and there are some not so goods to it. So why don't we'll talk about what's good about it. Is it a reliable test? The answer is yeah. It's a PCR test, which is considered to be the gold standard of testing. It's supposed to be very accurate. Is it a convenient test? And the answer to that is yes. It's a saliva test. You literally just put some saliva, spit into a test tube, and then have it tested. When it comes to cost, that's another issue. Basically around $129. And the question will be, is this something that is covered by your insurance, or are you going to pay for it out of pocket? Most likely it is going to be out of pocket. So it's $129 per test. The biggest issue comes from the fact of the logistical aspect. You can't just go to Costco and buy a test off of the shelf. It is a situation where Costco is actually an intermediary with a testing facility. And so what you do is you go to Costco and you order a test, you get a coupon code, and then you go home, you go online, you enter your coupon code, which goes to a third-party testing facility. The third-party testing facility will take your health information via a questionnaire, as well as your health insurance information and then some other background. And then they will overnight you by UPS a testing kit. And then when you get the testing kit, you then will perform the test, spit into the test tube, and then you need to take it back through UPS to get it to the testing facility. And the testing facility says that it'll be about 1 to 3 days before you'll get a secure email with your test result, either positive or negative. So what's the problem with that? The thing is that really the time frame is not really that much better than what you wind up getting if you go elsewhere. And particularly, it certainly is not a rapid test by any means. It is a type of test that can take many days to get a result. And like any other type of test, it is simply a snapshot of your positivity or negativity at the time you take the test. So let's say you get your test ordered on Monday, you may not get a result until, let's say, Friday. And a lot may have happened between Monday and Friday. So in terms of where you stand, once again, it is just a snapshot of the time you took the test, and it's not as easy as it sounds. So we'll see.
Yeah, that was a lot of interesting information, and that, yeah, the turnaround time not quite as fast as people think. So great information. And we know the CDC released new exposure guidelines. The previous guidance suggested close contact was when a person was within 6 feet of someone with coronavirus for 15 consecutive minutes. Tell us what's changed with that.
Yeah, it's interesting because we always thought you had to be within 6 feet of somebody for at least 15 minutes before you really had to be concerned that you could contract the virus from someone who is carrying COVID. But that's certainly not the case in any way, shape, or form. We think there are a lot of other variables involved. In fact, we think at this point in time, probably one of the major drivers of infection, and with the surge of infections we're seeing, are actually a little bit lesser periods of times that add up over the course of a day. I'll give you an example of that. Let's say you go to an office setting and you are in a office where someone does have COVID, but they are far away from you. But let's say you have several contacts with them over the course of your workday. Even though they're short contacts, they add up over time, and as a result, you can wind up becoming positive or catching the virus just even with those multiple shorter exposures. And when you think about it, it's not just a workplace. It certainly could happen in a household. Grocery store workers are at increased risk because of their contacts over the course of the day. We worry about healthcare workers. I mean, we worry about everybody. And once again, we go back to the very basics of what do we do in order to slow things down. And once again, it comes down to, the hygiene, it comes down to distancing, but really the number one thing we know that works is a mask. So please mask up, especially as we go into this colder weather and into the holiday season.
Great. Dr. Dave, thanks so much for joining us, and we'll see you back here next Monday at 11 a.m. as we answer more coronavirus questions.